Welcome everyone to the live on ServiceNow. We have an exciting episode today for optimizing healthcare operation. And this is the new capability which will launch in healthcare and life sciences product in ServiceNow in Yokohama Q1 2025. The product is really focused on the healthcare providers. But before we go further details into the product, um, the safe harbor notice, because we will be sharing some forward-looking information as in roadmaps and other capabilities. With that, again, thank you for joining. For introductions, I'm Sandeep Pandita. I'm the outbound product manager for the healthcare life sciences product in ServiceNow. Just to give you a quick QR code and information on where you can find all the other interactive live on ServiceNow sessions. So if you have a phone, feel free to take this screenshot, or you can take this QR code and it will give you a link of all the upcoming episodes which are coming in the live on ServiceNow sessions. With that, a few housekeeping. We have saved time for Q&A in the end. Otherwise, feel free to ask your questions in the Q&A button. The presentation will be recorded and shared on ServiceNow community. Also, it is posted on the YouTube in the ServiceNow channel. And after the event, we will prompt you for a short survey. So please provide your feedback. With that, let's go into the new product which was launched in the Yokohama Q1 2025 release. Let's talk about the challenge every hospital faces, which is the non-clinical burden which a care team faces. The care teams are burning out not because of taking care of the patient and the patient care they are providing, but they are being burnt out by the admin task which they have to manage almost 28 hours per week by a given care team. And by care team, we mean any of the nurse director, nursing manager, and even the clinicians who are involved in the direct patient care in a given hospital. Whenever a care team needs to report an issue or request any services, they have to interact with multiple systems. Some of the numbers which we heard in our product advisory councils and even in the Knowledge 2025 sessions was a nurse on a given day interacts with 50 plus applications in a given day of her work. To resolve that issue, which we are launching a new application and a product called Care Team Operations, which is a unified intelligent experience designed to provide the care team the required services within their EMR experience. Again, if you look from a care team point of view, the current challenge they have right now is the experience is really manual and fragmented across the entire operation services. And it is costly and inefficient. Costly because the care team time is being spent, and inefficient because there are a lot of touch points, which is leading to a very bad patient experience. If you think about it from a care team, whenever they need to request any services from the support services or anyone on the back end, they have to use one of the omni-channel tools. Think about phone call, emails, and even Teams and sometimes spreadsheet to request services anyone in the support services, which is the biomed, nutritional facilities, EVS, or even the IT and the EMR team. Currently, all of these promises of digital transformation have not seemed real for the care team. They are still bogged by the amount of time they have to spend and also the number of systems they have to use to make these support services. With ServiceNow, we are trying to bring an intelligent orchestrated system to automate work for the care team to easily report and resolve any of the operational issues they have for a given patient. So from a care team point of view, they can use the EMR embedded experience, and this is what I will show you in the demo. So the care team does not have to leave their EMR, and then they can use, and also they can still continue using a service portal, a phone call, or email if they want to, and they can request service anyone in the backend or anyone in the support services from a facilities, biomed, EVS, IT, or further as we move along into even the radiology and the lab departments. And on top of it, we plan on launching the AI care agents, which can really automate and route the ticket based on the information provided by the care team. And again, this really focuses on a better experience for the care team, but at the same time, improved workflow and an improved experience from the support services. And this brings both the care team and the support services in one single experience. One of the key callouts you will see in the demo is we are ensuring the persona continues working where they work. So a care team works in the Epic, and we will see that they continue working in the Epic while the support system works in their entire IT or their work order system as we go in the demo. All of this experience is built on a single AI platform for business transformation. So starting from bottom to the top, again, we have the infrastructure of ServiceNow. It can be integrated to the multiple systems. And on top of it, we have the data using the workflow data fabric. We have the workflow for automation and even the AI agents. And then on top of it, we have the AI with the AI agent studios and our own models. And on top of it, that's the experience which we are building for the care team as well as support services for improved patient care. With the item on what's new in Yokohama. As I already put in the preface, the new capability is coming out is called care team operations. The key item which we are trying to focus is reduce care team burnout for requesting non-clinical operational issues via EMR integrated experience. We can track up and speed up the issue resolution because we are providing a single view of non-clinical operations. As you can see in the diagram on the right side, this is a single experience. They can see all of their IT, biomed, or facilities issues. And not only they can see their issues, they can see the issues for their entire unit in a single view. This reduces the issue which we are seeing of duplicate tickets being reported, especially as there are morning to evening shift change, also as there are travel nurses or there are new nurses which are being onboarded on a weekly basis in a given hospital. So that's one single pane of experience across your entire unit, reduces the number of duplicate tickets which a typical care team member creates for support services. Also, we are preventing downtime by proactively addressing the non-clinical issues and automating the workflow. In the upcoming demo, you will see the IT issue automatically creates an IT incident, and the biomed request already creates a work order. So we are really providing you an out-of-box functionality of automating the workflows. So it's a faster time to value for you and a faster time to value for the care team and the patient. And on top of it, you can use AI to really categorize, route, and resolve all of these issues. You can do and remove all the manual efforts over there. With that, let's go into the demo. And over here, I am going to do a live demo. So please be mindful if there are so many delays. So now you should be seeing my Epic instance. This ServiceNow has signed vendor services agreement with the Epic, and we are working in very close collaboration and like engineering efforts directly with the Epic. And that's one of the reasons we have the vendors services instance with Epic. Again, this is not as rich as yours. Yours will have more module, will have more data, but from our point of view, it provides us sufficient integration data points and checkpoints to work on the Epic. So in a given Epic, as a clinician who's logged into the Epic instance, they can click the care team link, which is again one of these links, and that will open the entire care team portal within their EMR experience. As you notice, a clinician does not have to go out of an EMR to report any issues or even see this service portal. To my earlier comment, we are meeting personas where they work. So a clinician mostly works in the EMR, and hence we are meeting them in the EMR system over here. Again, this is based on the ServiceNow service portal. So you have all of your catalog requests over here. You can see all the catalog requests which we are providing out of the box, which is the IT, biomed, facilities, and even the EVS. And furthermore, just to wrap up the service portal part, you can add as many KB articles as you want. And on top of it, we have a Now Assist right on the service portal. So this is a entire portal experience, a care team portal experience a care team can expect within their EMR. As mentioned earlier, they not only see all the issues which they have reported, they can see the issues which have been reported by anyone within their care team unit. As you can see in the primary contact, we see multiple primary contacts members over here because again, anyone within their care team unit can see these cases. This provides a single pane of experience. This reduces the duplicate tickets being submitted by the care team for their given support services like IT or biomed team. A couple of questions which we do receive. How do you define a care team? These are the my teams which will be used. And then these are the things you can set up in the backend as an admin. And also we can get this information directly from the Epic. Um, Another questions which we typically get asked is how is the integration setup? As I mentioned earlier, we are working directly with the Epic. So we are using a Smart on Fire for customers who are currently using EMR Help. It is not a digest token. Just to be very clear, this is literally built on the Smart on Fire, and we are really providing an out-of-box experience for you directly working directly with Epic. It improves the integration quality and also it improves the encryption and the amount of Epic tokens you can ingest within the ServiceNow. With that, let's go into how will a clinician report an issue. Again, as I mentioned, they cannot only see all the issues, they can also even filter for the IT services or the biomed services issue they have. So let's say they are having an IT issue. They go ahead and click the catalog request for IT service, report an EMR issue. And this opens a record producer for them or a form for them to report their issue. Again, this is a vendor services, so we are not able to capture the Epic tokens, but in your instance, you will be able to capture Epic tokens directly within the ServiceNow instance. These are almost like 100 plus Epic launch tokens. That's the exact name which Epic says, which you can ingest directly into the ServiceNow instance. So this can be anything, as you can see, workstation ID or login department ID, but it can be also be provider related information, patient related information, department location. If anyone wants, I'd be glad to provide the exact all of the Epic tokens which you can bring into the ServiceNow. And on top of it, as you can see, we are providing a very streamlined experience for a care team to fill the form. They can select the unit they are working in. Again, as I mentioned, we understand that the care team moves from one care team unit to another unit pretty often. So they can select the unit they are working in, and they can say, open a ticket, patient data. They can even select an urgency. And on top of it, they can define a contact person. The contact person is typically a nurse administrator or a unit secretary who is working within the care team unit. And the reason for that is so that when an IT team member or a biomed team member has to follow up with the care team member or a nurse in this example, someone in the unit secretary can handle it. Right? So the nurse can continue focusing on the patient care and continue providing a better patient experience rather than taking care of the operational issues over here. So over here, we have Sofia Garcia, who's a unit secretary. And again, if you want, you can attach a screenshot. You can just use the Windows capability to take a screenshot and attach it right here. And as you can see, we have an attachment and they can go ahead and submit a ticket. Couple of items over here. As you can notice, we started with a healthcare IT case or like a case, and the system has automatically generated an incident over here. This is to my earlier comment, we are providing out-of-box automated workflow. So an incident has been created and an IT agent or an EMR agent can continue working on an incident. Again, personas, we are meeting personas where they work. So an IT agent works in an incident, they can continue working in the incident even in this system. Similarly, let's go for a biomed. Again, if it's a biomed, you can even use an AI assist to create a biomed agent because you are not capturing any of the information from the EMR. So you can use this. But over here, we can just go ahead and create a biomed request. You can again report a medical device issue or report other biomed services. Over here, reporting a biomed medical device issue. Again, they can select the unit they are working in. They can add the asset tag. And if they add the asset tag, we can automatically identify the asset as well as the asset model for which the issue has been there. Also, they can assign the location. Again, one thing we did notice that the devices do move a lot, especially mobile devices like infusion pump, ultrasounds, and so on. So they can even assign like, hey, what are the room or the location where the device is, and say, just create an issue. Let's say. Similarly, they can create an urgency and a contact person, which we'll do again, Sophia over here. And sorry for the few seconds delay. Again, this is a live instance and a live demo I'm giving you. Um, and similarly, as you can see, a biomed case over here, we are creating a work order. We are not creating an incident because we know the biomed teams or even the facilities and the EVS team, they work out of the work orders. So we are automatically generating a work order for them. Uh, so now that we have finished the demo for the care team experience, let's go back to the back end of how are these services being fulfilled. Um, so starting with the IT agent and the incident which has been created. Let me go ahead and log in back. Okay, perfect. Now I'm going to impersonate as a IT agent. Over here we have Ash Davis, who is an IT agent. So impersonating as an Ash Davis. An IT agent typically works in a service operation workspace. So we are navigating to the service operations workspace. And over here within the incidents, as you can see, a system has already created an incident. This is the incident which we just created on May 20th. And again, the incident has already been created for him. An agent can go ahead and work directly into an incident. An incident gets all the information directly from the healthcare IT case. As you can see, we have a Now Assist also working over here. And one of the key callouts is the caller is Sofia Garcia. It is not the Ava Lewis who was the nurse who was logged in into the system. It's the Sofia Garcia who is the unit secretary. So whenever Ash Davis needs to reach out, he can reach out to Sophia for this issue. Similarly, we are capturing all the details. So all the details are captured over here. And just to show you where are all the EMR information captured. So all the EMR or all the Epic tokens are captured in the healthcare IT case. And the reason for that is keeping a delineation between who can see the PHI or the patient and the provider information and who cannot. Typically, working with the hospital systems, we learn that there are a group of IT agents, typically referred as EMR agents, who are the only one who can see the patient and provider related information. And that's why we have built this separation between who can see what information. So someone who has an access to an healthcare case or HCIT case can see all of the information over here. Again, even including the screenshots and all of the Epic tokens which were provided. But someone who's working on the Epic, on the incident cannot see them. So the workstation ID user template is only available to someone with an HCIT case. And this is to make sure that we are providing the right security and the right out-of-the-box ACLs for you to manage your incidents. With that, again, within the incident and the case, we are providing you an out-of-box sync between the incident and the case. So you can say, please, an example, and they can go ahead and post it. And let me go. Oh. And now I'm going to log in as, sorry, I was already logged in. Let me log in back again as Sofia Garcia. So this is the unit secretary who is working with Ava Lewis to ensure that the Ava Lewis continues working with the patient and is not bogged down by these operational issues. Oh, sorry about this. Okay, let me just impersonate again. Let me just go into the Ava Lewis experience. The only thing I wanted to show you was again, as you can see within the case, the note from the IT agent has directly been updated over here. So please give me an example. You can say patient ID. And this will show up exactly the same on this end over here. Let me just refresh this page. And you can see all patients are not working comment does show up on the IT agent. So we are providing you an out-of-box sync for the comments between the case and the incident. And also, if we go ahead and resolve the issue, let's say solve by request. Again, as you can see, the state has been moved to resolved. And even on the Epic side, the case has been moved to resolved. So we are providing you an out-of-box, even the status sync between the incident and the case. Furthermore, nurse or a unit secretary can go ahead and accept the solution, which will move the ticket status to the closed. So that's for the IT incident. Similarly, for the biomed, let's go to the biomed manager. So we have Maya Patel, who is a biomed manager. And again, biomed managers work directly into the work order system. So going into their work order systems, as you can see, the system automatically created a work order, and the Maya can directly work in the work order. She does not need to work in the biomed case. And we are providing an out-of-box sync for the biomed case and the work order. Similarly, we provided for the incident as well as the case. So any of the notes, any of the comments, any of the status update will be synced between the work order as well as the case. Just to simply show, you can go ahead and ready and qualification, which will create a work order task. The work order task can be assigned to anyone within the given unit. And again, if they want, they can provide any of the comments, which will sync directly with the case. This is the part of the demo which I wanted to show for the biomed part. Any questions over here?
Yes. We had a couple that I answered that you can verify, but why don't we wait until the end to answer all the questions?
Perfect. All right. So just to wrap up the demo, I hope within the demo we showed as a care team member, we can provide them more time with for patients because they can submit and track issues and requests directly from the EMR and upcoming in mobile and web. And then they can report all type of issues, whether it's an IT, biomed, EVS. They do not have to go to different systems or different interfaces to create these different type of issues, which is currently the current hospital examples which we have seen. For care team leaders, they can view and manage all of their cases across all of their team members in one single pane of experience. So from their point of view, again, they don't have to go to different systems like a different IT portal, biomed portal, or EVS portals to see all the issues. Everything is shown in one single experience for them. And again, we are providing an out-of-box automated request and task assignment, both for the incident as well as biomed and facilities. Furthermore, from a support services point of view, we are ensuring the support services continue working into their current experience. So an IT team can continue working into their incident, and a facilities or even the biomed team can continue working in their work order experience. So we are not changing their experiences. We are not changing the systems in which they are currently working on. With that, just to recap the couple of value and the outcomes which we are trying to achieve with these uh, new care team operations capability which we have launched. Uh, from a ServiceNow care team operations, we are providing self-service to the care team to empower them to do more. From an efficiency point of view, as I showed with the automated workflow for both the incident case as well as the biomed case and the work order, we are making sure it's a streamlined operations. Um, from a support services team, we are really supercharging their productivity, not only with AI, but ensuring that they continue working in the system in which they are currently working. And again, automating the entire experience from an IT, biomed, and facilities point of view. Just to deep dive further into the capabilities which we reviewed, from a self-service point of view, again, we are providing a care team a single pane of experience, a single pane of vision to report any type of issues, request, or services. And again, all of this is within the EHR embedded portal. So within their Epic, they can really see a service portal to request any of the issues. They can go ahead and use a virtual agent or Now Assist to report a medical device issue, EMR, or even EVS issue. And again, this is a care team portal. These are not the issues which you are seeing for your own items. These are the issues you are seeing for your entire care team unit. So anyone within your unit has raised an issue and they have gone for, let's say, gone for the day, for the morning shift or the evening shift, the entire unit can still have the visibility. And especially if you think from a nursing, a lot of the nurses work in the 312s or the 410s schedule. So they are working 3 or 4 days and gone for another 3 or 4 days. That it's more imperative that entire care team unit has the experience for what are all the issues everyone is raising. Uh, Moving to, again, we are connecting the care team with the support services. As we talk to multiple customers, we learn that this experience is currently very fragmented. There are a lot of phone calls, there are a lot of emails, and a lot of Teams conversation when the care team is trying to get an update about their open tickets. Over here, we are providing an out-of-box service catalog. So every request type looks very similar and it provides that unified experience to the care team. Another thing which we heard was they are going to a different IT, biomed, and EVS, and the user experience and the forms which are being requested, the type of information which is being requested, or even sometimes how are they being requested are really different. So which really boggles the care team as they are submitting different requests. So this really streamlines that experience, and providing that out-of-box service catalog not only provides you a care team, but also from an admin or a platform manager point of view, you can take these service catalogs and extend new service catalogs as per your needs and your business wants over there. Again, we are providing an out-of-box EMR request and biomed request as I showed in the demo. And on top of it, we are providing an out-of-box healthcare organization data model. And the reason for providing an out-of-box data model from an organization point of view was to ensure that you are able to model your healthcare organization, sometimes with multiple locations and multiple buildings, into a ServiceNow in a very streamlined manner for faster time to value. As we were working with multiple customers, we realized that this one of the key challenges is how do you take a hospital setting, especially a hospital which has multiple locations, and how do you model that within the ServiceNow? So we are providing, or we are structuring a very streamlined data model for you to enter all of these values. This will not only allow you to manage your internal hospitals, but also enable to manage your external hospitals. So think about like a lot of the hospitals we are working with are providing Community Connect. So this is like the Epic Community Connect use case we are talking about. And if you're providing IT services to them, this care team operations will work out of the box for you over here. So this, and again, all of this is supported because of the data model which we are providing you out of the box. So not only you can manage uh, not only can you improve and manage internal operations, you can also make it into a revenue factor by better managing your Community Connect and your external locations. Um, Furthermore, we are boosting support service productivity. Again, this is really focused on the AI. You can use AI to diagnose, resolve, and document problems. We are providing you the automatic incident and work order creation. Again, that's the healthcare IT case and the incident, as well as the biomed case and the work order, which we provided to you in the demo. And again, we are providing enhanced collaboration with real-time incident work order, both the comments, notes, as well as the status things, kind of like the same flow I showed you in the demo. From an image point of view, again, an agent workspace for work order. So a biomed team can continue working in the work order. We have the AI case management with the Now Assess skills, and then we have the workspace for the healthcare IT case. And also we have an incident in the service operation workspace. And the last item we have is the automation. We can automate tasks and improve processes. Again, we are enabling workflow across teams to improve efficiency, streamline processes, proactively solve issues. But more importantly, you can see how are these processes being used or worked on in the real time. So you can do the process mining and see what exactly is happening in your incidents and in your work order in your case, and also use the performance analytics to improve your processes. So not only we are giving you a capability to make the existing process better and automate and be proactive, but also identify the bottlenecks, which is really reducing or increasing the time of hospital operations, and optimize that performance for better care team experience and eventually a better patient care and a patient experience. Pretty much our roadmap and all our focus on the care team operations, as I mentioned earlier, is focus on the care team members so that they can focus on patient. They are not focusing on the operational hurdles, on the operational issues. They are really focusing on the patients, and we are providing them more time for patient care. As a care team leader, they are really enhancing the efficiency and managing their headcounts very effectively. I don't think I need to say anything about the nursing shortage and how do we make sure that that the headcount does not become a problem from a care team leader. And from an IT or anyone in the support services, think about even the biomed or even the facilities. We are ensuring that they use the familiar tool. They are very well connected with the care team and the care team leader, and they have everything in term to support and ensure the care team can provide better experience to patient. With that, again, we are increasing the clinical productivity as we are ensuring that the nursing is managed at the current headcount. We are ensuring faster issue resolution and cost to service from a support services point of view, and also reduce downtime and service disruption with not only the AI agent use case, but also with the existing automated workflows and the automated case comments and sync capability point of view. And all of this will lead to a higher patient satisfaction. So we are really focused on a better and improved patient satisfaction, patient experience, because in end of the day, that's the reason for being in healthcare. I think that's one of the reasons I've been in healthcare. And I think if you hear the Knowledge 2025 story, everyone has been impacted with their healthcare journey someplace or another, and that's the reason they continue to working in the healthcare industry. And pretty much everything I said in last 45 minutes, the crux is how do we provide better and improved and higher patient satisfaction. Thank you for joining today's session. And we will definitely, again, as I mentioned, this will be posted on the community. We will be sharing all the information back to you. Thank you.